Alright, hi. So today we're going to be showing the Texas A&M University-Corpus Christi COVID-19 response dashboard. So our dashboard can actually be located in one of two places. So if you come here to the university, if you click this link, it'll take you directly to it. Or if you go to Conrad Blucher Institute.org, you can hit the COVID-19 link at the top right of the page. So on this page, our landing page, all right, we're going to have links to both our desktop and mobile dashboards. So depending on which device you're on, we'll obviously decide which one you're going to pick. We'll have occasionally we'll have videos kind of showing some of the changes or new information that might be on the dashboard. And here you're also going to be able to get access to all of our static maps that we keep publishing every single day. So you can download them as PDFs, and then from here, you can either download it from your browser or save it however it is that you want to store it. But on this page here, we'll go ahead and get into the dashboard itself. So here, there's a lot of information that's being shown, so we'll just kind of work our way around the dashboard itself. So here on the left, we have these counters. So the statewide confirmed cases, this is the number of cases that has actually been confirmed by the Texas Department of State Health Services. This number comes directly from them, and it's updated once a day right around noon. Our total deaths number is also from the Texas Department of State Health Services. Now, our statewide reported cases, this number is actually coming from Johns Hopkins University. Johns Hopkins University has created a great network that is not only collecting official data, but all kinds of different media reports for the entire world. However, their numbers, again, because they include media reports, might not be entirely accurate. So that's why we still base all of our numbers off of the Texas Department of State Health Services numbers. Here on the map itself, you'll see there are two different kinds of symbols. There is a choropleth, that's going to be the kind of scale of colors showing up as fill in the counties. Obviously, as we have more total cases, that number is going to become a darker and darker red. Then the dots, those purple circles, they're going to be representing the number of new cases in those counties. One thing that's nice about this map is that it is interactive. You can zoom in, zoom out, you can pan around. If you click on a county, all right, you're going to get a pop-up that's going to give you the total number of new cases, and it's going to also show you the total number of cases that existed in that county, starting with March 11th, coming up all the way to whatever our most recent data update is. Some other things about the map, so that is pretty beneficial versus just kind of knowing what's happening in your immediate area. You get to see what's happening around you because the map is interactive. Also, say you know where somebody lives, but you might not know necessarily the county they're in. There is a search function up here on the top right. So if you just know the city they're in, or maybe the exact address, if you type it in, you can search it. It'll take you to that point. And if you zoom out a little bit, that dot stays on there, so we can see Junction County, and then if I click on the county that it's in, you get the pop-up. I see, okay, it's in Kimball County, there's no new cases, and there have been no confirmed cases since March 11th all the way through March 30th. It's a good sign for Junction and Kimball County. Other things that we have on here, so here on the right, we have these different graphs and charts. Our graph, this first one here, most impacted counties, is actually going to be looking at the 10 most affected counties right now. So the 10 counties with the most cases. Again, as the state updates their data, this will update as well. At the time of making this video on March 30th, Dallas and Tarrant County hadn't updated their data yet. So the numbers are actually a little bit different than they are showing right now. Likely different. If you click on it, it'll pan to and kind of flash on that county, so you can kind of see exactly where it's at if you're curious where some of these counties are. On top of that, or next to that, We have another graph that gives a breakdown of how much different public health regions in the state of Texas are being impacted. So each county belongs to a public health region, and that health region is going to kind of be what the state uses to assess where they're going to be sending supplies and understand exactly what's the capacity to support COVID-19 cases, or just really any health element in general. Below this, we actually have three different charts. This top one here is going to be showing the total number of confirmed cases by day, and we can kind of see that increase. Below that, we're going to be showing two different ones that are on top of each other. First, there's the Texans tested one, so we can see how many people have been tested, and then whether it was at a private lab or a public lab. Below that, there's a tab down here that you can click, and then it'll show you the total number of deaths. So this is the chart that we want to start decreasing the absolute most. The fewer people are dying, the better. It's one thing to be sick, but no one wants to lose a loved one. And then here, actually, the map itself is on top of another dashboard. There's a bit of dashboard inception going on here. We actually embedded this dashboard from ESRI, which is a global company which not only created the technology that all of these dashboards are based off of, including the Johns Hopkins one, but they also are a major data provider for a lot of the world. They work with a lot of universities and governments in order to get data out to us. But here, we can actually select our state. We can pick Texas, and since I live in Corpus Christi, I'm going to look at Nueces County. And then here I get a report on kind of what Nueces County is looking at as far as COVID-19 is facing. So we get an ideal look at, how many licensed beds, medical beds are there in Corpus Christi, which hospitals are they at, as well as staff beds, things like that. And then we also get, number of intensive care unit beds. So if people are they're going into critical conditions based on COVID-19, this is the potential we have to support those individuals. So it's really worth looking at that information. And then, breakdowns of different demographics as it relates to COVID-19. So, especially our at-risk populations, people with disabilities, without vehicles, and of course the elderly, are all individuals that we're going to want to be able to track and look at. That way the county judge can analyze if she needs to redirect resources to kind of help those people who aren't able to help themselves. We kind of get a look at that and get to see, what it is that we need to do to make sure that everyone in our region is going to be safe. Other than that, that's everything. We do update our last confirmed date every single day that we do update. So if you're ever looking at our map, looking at the data, and you're thinking, it looks pretty similar to yesterday, I don't know if it's actually any different, this here will be your kind of telltale sign. If this says March 29th and today's the 30th, then obviously we haven't updated anything. So do keep that in mind when you're looking at it, and we'll update as soon as we can. Alright, so that's all we have here. If you have specific questions, you can always find the Conrad Blucher Institute on Facebook. We get a lot of questions there all the time about the maps, about the data, what we're doing, suggestions, things like that. We do like to hear from the public because we want to make sure that we're providing this information to you in a way that's beneficial to you, because that's why we're doing this. The main reason we're doing this is to get information to the public. That's our number one priority. After that, if we can help governments, local agencies, whatever, manage their response, we would love to do that as well. But first and foremost is the people. All right. Thank you.